Thank you. My name is Tim Baird. I'm a local physician. I've been in Jacksonville for almost 30 years providing OBGYN services. I probably delivered about 5,000 babies, and could be that maybe one of you was one of the babies I've delivered. I'm all for improved access to care. Obviously, I see a lot of patients every day. When I'm on call, like I was this weekend, I spent my time in the emergency room seeing patients who were walking in the door pregnant, who had received absolutely no prenatal care. Now, that's one of the problems that we deal with as physicians, is that we see them at the end of the scenario and we deal with the problems that are there. I'm all for reducing cost of the healthcare system, but as a physician and who has lived and breathed this for 30 years, I will tell you the biggest cost to this system is not Medicare fraud, it is legal fraud. And when I say that, I mean the medical malpractice problem in this country. When I worked at Shands doing my training, I found that I was immune to any kind of legal suits. We practiced, I thought, excellent medicine. It made me the physician I am today for having worked through that system. If I worked at the VA, I'm also immune to medical liability. When I moved into private practice in 1984, I was then subject to the medical liability scenario. And the costs started off fairly nominal, $10,000, $16,000, $20,000, $45,000, and topped out somewhere around $85,000 that I would have to pay on any given year just to be able to provide care for patients. My concern is that when Mr. Obama has been asked about health care reform and how do I reduce costs, on several occasions he's been asked the question, what will you do for tort reform? What will you do to help reduce medical malpractice concerns? Because it is a truly significant part of the cost when you have physicians who are practicing defensive medicine and they're ordering tests and diagnostics because they don't want to miss anything, because their concern is that they're not only just that they will get hit with a liability suit, which can go into the millions of dollars, especially my specialty, but you've run into a scenario where this is going to increase the cost for everyone because of the amount of malpractice that will ensue. So my concern is when Mr. Obama has had this question proposed to him, he has been in the negative on this, and that he will not make that part of this healthcare reform which it needs to be. If we really truly want to change the focus of medicine in this country, if we want to improve access, if we want physicians to want to go, students to want to go into the fields of nursing, if you want them to go into the physician roles, then you have to give them incentives. And one of those incentives is not necessarily financial, it is the protection from medical liability. There are safe havens, the VA or Shands, but the rest of it is exposed. And it tarnishes our ability to be able to provide the quality care that we want to provide our patients. As you mentioned about evidence-based medicine, I worked at many different places. I've worked at Shands, I've worked at St. Vincent's, I've worked at Memorial, I've worked at St. Luke's, I've worked as a clinician at the Mayo Clinic. And I will tell you that there's a lot of very, very good medicine going on in this city. Access is a problem. Cost is a problem. But we have to get the tort reform going and get it done at a national level so that we can get this moving forward. We would like Mr. Obama to speak up to this and realize that as we negotiate, which is what this is, we try to negotiate these health care bills. You have the Republicans on one side, you have the Democrats on the other. I thought it was really cool that what I heard here tonight was everyone said, no one's listening to us. I see the other side of it, and you know what? Those people say exactly the same words. No one is listening to us. No one is listening to all of us. And we need to make sure that if we do this together, if we push forward to create a bill that will be a blend, hopefully, of what everybody's wishes and desires are, that part of that will be tort reform, and that we will work to make sure that these physicians who are doing all this defensive medicine find themselves a little bit more freedom to do what we call evidence-based medicine and do what really makes sense for the patient.
Yes.